Good afternoon, everybody. Welcome to the update for our performance in March post our governing board meeting. So there's a couple of topics, quite a few we want to touch today. One is, debt reduction update. A couple more times, Ryan, going to have to talk about that. Other than it's paid off, and so we're getting super, super close. So I'll give you an update on that. Our swing bed program, we still got a lot of work to do, and I'll talk a little bit about that and kind of how we're going to continue to build that. When we think about our key performance indicators on how we are trying to move the organization forward, we've had some good maturity in that space, and so I'll talk about that a little bit. Ortho program, which is that first kind of when we look at our service lines on how we want to really build a program, which kind of goes even before surgery and then, weeks after they're actually in part of their recovery phase. Give you a little bit of a community update, some physician recruitment, a little touch on legislation. There was a lot of stuff that was kind of swirling around, but very few things actually kind of made it to the finish line, if you will. And then also give you an update on IT from that perspective. So from the first one is related to our debt reduction. Super, super, super excited to share that, as of this past Friday, we're now below $2 million for, total old debt, right? Anything that was, 24 and back. And so a lot of that, some of that debt went all the way back to 2020. So some of it was 4 years old, but we've got kind of all the big players, like Cerner was one of the ones that we owed about $2 million to, and that has been paid. I know there was some, activity in the paper related to the city and us owing $1.5 million, I think, related to old electric bills that we hadn't paid. Both of those have been fully retired. The electric, actually, we had committed to the end of February. We actually paid that 2 weeks early. So quite excited about us really getting, some of those kind of big balls and chains, right, that are kind of, dragging us down for us having the ability to be able to move the organization forward, kind of, chipping away and getting those things knocked off. So the goal for us is that the plan is that less than $2 million is going to be fully retired by the end of this month. So when I'm kind of back doing this for after the next board meeting, the plan is that we will have that fully retired. Then the exciting thing as we think about, okay, then what do we do? Well, we're looking at kind of two pieces, right? We're looking at, from an operational standpoint, can we cover our expenses by the revenue that we bring in? And we are chipping away, as I've talked about that at the employee forums. We were about $300,000 away from us being able to kind of have a balance, right? We had enough revenue and it matched the expenses, and, we were not red. And so we're super, super, super close. We're in the middle of close right now for March, so I don't know what those numbers look like, but I will be able to give that feedback when we have the employee forums on the 16th of April. But as we start to continue to move that forward, when we don't have, it's just like your household bills, right? If you don't have bills, you have the ability then, right? There's not a whole bunch of the money that you get in your paycheck that's already accounted for, right? And so that was our case. With this huge amount of debt that had been, been accumulated over years, we were trying to pay that down and really impact that in a positive way. And we struggled with it because that increased, the things that we were having to outlay that was taken away from that revenue we were getting from all the work that y'all are doing. So once that's fully retired, that allows us to start thinking about all the infrastructure things that we need to actually replace. And y'all know it because you're living in those spaces, right? As we think about patient rooms, a modern, expectation for most surgical or medical patients, either one, is that they're going to be in their patient room and they're going to be comfortable. And we don't have the ability to really do that effectively because our rooms are not individually controlled by individual thermostats, right? And so that is just an example, but it's a big deal for comfort level and for us having the ability to grow our volume and have people want to come to our facility for the care that we deliver. And so things like that, we're building into kind of the strategies and as part of our kind of plan as we look at the organization and the facility infrastructure on what that needs to look like as it relates to how do we modernize that. Another great example is, a few of our ORs when it gets really, really cold or we end up in monsoon season, right? Then our humidity goes up or the temperature when it's really cold, we can't control it and keep it high enough. And so that can potentially give us the ability or a lack thereof of being able to use those rooms. I mean, humidity gets to a certain threshold and we have to shut the OR down. The OR is a big source of revenue for us. So that's really important. So the cause of that is we have old, very old HVAC systems that we need to replace. We have been replacing some of those. Have y'all seen the cranes in some of the areas where we've been? But there was a lot of them, and we had some were 35 years old, right? And so we've had some of that stuff kind of take place, and so now we're in a place where as we are not paying that old debt, we can start to fix those things. Carpet in the front lobby, right? First impression, aside from it not being, when you have ripples in carpet, people can trip. We don't want that to happen, but it also just doesn't leave a good first impression, right, of our families, visitors, patients that are coming in. And so those are things that we are going to start chipping away at this year, and we're going to have the ability to do that. So next thing I kind of want to touch on is really the swing bed program and the progress that we've had. We have made some great progress with the team. Still have we have a long journey. It's a pretty steep climb as it relates. There's a lot of regulation around swing bed and what we need to provide to them. You need to kind of really build that program. We have the ability to market it, but as patients, have to meet certain criteria to come in to the swing bed, we are one of the few places that has swing beds. And so you really get an acute rehab that is really a skilled nursing facility, but our ratios are better. I think we deliver better care. And so that is a competitive advantage for us. We will be able to take patients that need swing bed care from GIMC as an example. And so that's a way for us to continue to build that business. And as we do that, it's going to, kind of help us figure out how do we continue to get our reserves so we can continue to pay and modernize these things. So when we look at our business, we really should probably, and look at the population and what we could potentially pull from, we should typically probably run an average census every day of 5 swing bed patients. But we have a lot of parts we have to pull together in order for us to be able to manage that, educate everybody, and of course, make sure that we have really good outcomes as it relates to the patients that go through that program. Second or third thing, I guess, if you will, is the operational KPIs. So when we look at key performance indicators, I talked about us starting the huddle that we have with the leaders. And as we kind of get that, we're coming into the end of this month, because we're now in April, that we're going to roll that into departments. And so that is coming very soon. I will have those 2 departments that we'll start out with. Then I'm going to work with both of those teams personally. And I'm excited to roll that out because it's really going to engage you as the people that are actually doing the work. How do we solve the issues and challenges and things that frustrate you, that you feel like don't make it efficient, you feel like that can negatively impact patient care? How do we solve those things? We're going to solve those things together, and that's really the purpose of us really driving, those really high performing huddles to be able to drive that down into each department and have the right support upward for us to make sure that we're aware of what you need to solve. And then what we're there for is to help you with tools and take barriers out of the way. So super excited about that coming, and we will roll that across the organization as quick as we can do it in the right way. I don't want to shortcut it. I want to make sure people get the right support and that we have the right structure in place so that they can feel like that the work they're doing is meaningful and they can actually really have an impact. Fourth thing would be the ortho program. So we've had great progress. We've got the education schedule on what we're going to teach. We've got, the program book for us to be able to give the patients. We have developed the processes on how and what we need to schedule in advance for us to get all these pieces to fall in sequence. Really, our last thing is really to get our orthopedic providers to kind of, one, give their full input of things that they want us to tweak. And then once we kind of get that approval, then we'll actually kind of set a go live date for the official program to actually start. So that is going to bring a huge benefit. As we learn, we will actually roll different service lines into the same kind of program structure as we go forward. So, when we think about, our providers and we think about how we want to be good partners, we're going to continue to kind of connect and think about how we can connect and support each other. So one of the programs that we will be participating in is some education and health screening support over at the university, right across the street from us. And so that's just one little example. When we start to think about some of these new service lines, women's health will be a great example of that. When we get ready to roll that out, part of that, not just initial strategy, but ongoing strategy, is for us to have some targeted kind of health screenings, for us to be able to really capture those patients. A lot of times when you think about when patients, if you're going to wait for them to kind of come into an organization, come into a hospital for a screening is a little intimidating for a large population. But if you have kind of a screening or a health fair in a place that's away from the hospital, you will get a higher percentage of patients that will be willing to do that. One, it doesn't cost them anything, it's free. And two, we're going to have the ability, one, it creates business, but the bigger thing is we're going to be able to catch a lot of people that may have potential issues going through that screening process that if they had not come in, that would have never been diagnosed. And so as we look at some of these key service lines that we feel like that having those kind of health fair and community events are going to have a big impact, and that service line is going to be able to touch a large portion of patients, that is some of the community involvement we're going to be doing going forward. On the legislative session, and I kind of tie this in with community because it does impact us. Dr. Andrade and her husband, both of them are going to be leaving our organization or leaving the community. He's an independent family practice physician, and she, of course, is a part of our team internally. So July 18th will be, kind of her last official day and his last official day, I guess, in his office. And so as we start to think about, why are these things happening? Why are some of the challenges taking place? A lot of that has to do with some of the legislation that we have not been, as a state, been able to actually figure out a way to manage that. So when we think about the lawsuits, and I'm sure many of y'all have seen some of those come across, we just had one a number of months ago that I think kind of set the record. And it's not a record that we want to be a part of, but it was really the highest punitive damages that's ever been awarded in a medical kind of malpractice case. And as those kind of things continue to kind of plague our state without the right kind of legal caps, it really creates a very difficult practice environment for our medical staff. And so, New Mexico we've struggled to have, provider recruitment, right? That's not been something that has been super easy for us, probably here or across the state, for many, many, many years. That's not new. But as these things continue to kind of escalate, it's making it harder and harder and harder for us to actually kind of overcome that. So there was a number of bills and legislation that were actually proposed this year a couple were actually kind of centered around really the cost capping related to punitive damages. The others were related to them actually having a bit of an ease, I guess, if you will, to getting an actual New Mexico medical license. One of the kind of constraints we also have, and we're one of the few across the United States, is if you have not done your residency within the United States, you are not entitled to be able to get a New Mexico license. There's only a couple of states in all 50 states that still has that as a requirement. And that, again, right, it's all these small things kind of add up to big things, and it kind of I guess sifts through, right, and it smalls down, or siphons down, maybe is a better word, that pie of the overall population of physicians in certain specialties. And then when you take all these restrictions out, then you end up having a smaller number of providers that, if they wanted to come here, would have the ability to do that. So we have to just continue to work on those things. And I feel pretty confident that, that a lot of that stuff is going to come back up into legislation this next year, but we don't really have any fixes for this year. And it is really going to kind of impact us, unfortunately. On the physician recruitment side, we have, 3 physicians actually. 2 are coming in this next month in May. We have another Dr. Khan, who's a family practice physician, who's coming in this month, at the end of this month. We have an interventional cardiologist, an interventional on the peripheral vascular side, that is going to be coming in May. And then we also have another urologist that is going to be coming in May. Both of them are coming from the same area, and they're kind of internal referrals, right? And we want to, just like we do with nursing or radiologist or, HIM techs, it doesn't matter. Some of the best recruitment is done by our team. And so this happens to be one of our new physicians that knows these 2 providers and knows them well. And he is kind of how we got connected with them. So we're excited about that. And we want to continue to definitely promote that. We've had a couple of, nurse practitioners and PAs also that are, working through from, some of the companies that we're kind of, partnered with, that are also interested in maybe working in some of the clinic settings. And so kind of that physician resource recruitment has definitely kind of gained some steam, and we definitely want to continue to make sure that we capture that. I think we only recruited about 3 physicians all last year. And so we could meet that quota almost in the first quarter if we can land all 3 of them. And so, our goal is to quadruple that by the end of the year. So we need to get that support in order for us to cover the patients that we have that want to come here and have needs in this community that we need to meet. Last thing I'll talk about is really kind of the IT update, because it's a lot of stuff that we don't necessarily see, but it absolutely impacts our daily work. So, all the switches were installed and completed. And so that was a pretty big undertaking that the IT team did, and it went reasonably smoothly. When we had that big downtime, I think it was in February, I believe, we were down for about 4 days. A lot of that was related to our servers and how they were configured, and that we did not have redundancy and backup. So we have reconfigured them, and so we have less of a chance, but we still have some new servers that we need to purchase in order for us to have real, true redundancy and limit those kind of downtimes in actual hours. But we also want to mitigate that to where we go for extended period of times with no downtime at all, right? And so can't plan for everything, but definitely right now we're in a better shape than we were 2 months ago. But in a few months, we're going to be even better than where we are today. So we're continuing to make progress in that space. The Wi-Fi upgrade, which really will impact everybody in the organization. That has started. The planning kicked off, and now they're actually, part of what they're doing is really determining where some of the areas that are not covered and how many actually kind of repeaters we need to put into place. So that is going to have a big impact all throughout the hospital. It's going to have a massive impact when we think about College Clinic and Red Rock, because we definitely have some down spaces in the clinic areas, And the goal is that we will try to get as close to zero as we can once we get finished with the project. Voice over IP, and that has to do with our phones and our phone system. Our phones are very old. We have, analog, digital technology. What we want to is that needs to become fully digital, right? And so, huge advantages for that because there's lots of tools that we can have access to, automated messages. If somebody can't pick it up, it rotates to the next person. There's a lot of that stuff that we actually can define over a much bigger level that will help us manage the workload, but also give us a much better experience when we think about the people that are calling in. So that is in progress. We already have the phones. We've just never been in a position to be able to implement them, and now we're in that spot. And so I don't have an actual final, okay, it'll be done by July. I don't have that date yet, as they're starting to kind of roll and start the planning prep process for that to take place. As soon as I get that, I'll kind of give you an end date once I know that. Cerner Uplift, we had some great participation with, our staff, our providers, really kind of, sharing with our, EHR partner on where we had some real pain points. And really the goal with taking those 4 days was to try to give them some insight as we do the uplift and we do the build. The optimum result would be that we want to have the majority of those things resolved or at least dramatically improved. So I want to thank everybody for the great participation because I think we were successful in being able to communicate that effectively. The last thing on would be the internet provider. So right now we have a single provider. We're working with Starlink for our internet redundancy. And so as we think about server, or as we think about sometimes, at 5 o'clock or 4:30, sometimes in the afternoons, for some reason, we tend to seem like the system gets really bogged down. And we tend to have slower speeds at certain times of the day. As we start to get some of this redundancy, when something starts to get past a certain threshold, right, it's going to shift over. And so it'll shift over in order to maintain that speed to allow that data to transfer throughout our organization. And it should be quite seamless to us. But that work is also going on. So a ton of stuff happening in the IT space. And now we're getting to the place where you're going to start to see and feel some of those things. As we continue to look at capital over the next year, we're going to start thinking about how and what we need to implement. Some of our first priorities are going to have to be kind of infrastructure like HVAC, making sure that we've got electricity, making sure that, we've got heating and cooling, etc., boilers working, all those things. But we also are going to make sure that we're also reinvesting for new beds and equipment and things that we need in the OR, things that we need in radiology. And so those are going to be a part of the process, but we have a lot to buy. And so we're obviously not going to be able to do all that stuff this year, but we're going to figure out what that plan is going to look like so we have the ability to communicate that to the whole organization. So I hope you found this helpful. I hope you're having a great first couple of days of April, and look forward to talking to you next month.